Hello and welcome back to another edition of our new series on health and wellness. We're here at the Battenkill Valley Health Center with Dr. Van Berckelaer. I hope I pronounced that correctly.
You did, thanks.
All right. Better known as Dr. Van to everyone. So we're here to talk today about mental health. And we'll be talking with Dr. Van for a little bit and then moving on to talk to one of their folks here at the health center. So Dr. Van, first of all, thank you again for making the time for this conversation. And I guess I thought we could just start by having you tell us a little bit about what your perception is on, kind of the level of mental health issues that is happening around our area, and why has mental health become such a big problem? I mean, in recent years, we've been hearing a lot about mental health concerns, particularly among teenagers and adolescents. But what is your sense of how that's going?
So I think that mental health concerns have been present in the community for a long, long time. But I think there are two factors that play into what we're hearing about more. One is COVID was a huge disruption, and it led to a lot of isolation. It led to some very big changes in the ways that we spend our time. Whether it was a shift to working from home for adults or a shift to studying at home for kids, and the role of school is a big, it's an enormous role for kids and teenagers. So that kind of touches on a little bit of what makes things different now than perhaps before. I think the other thing that's happened over the years, and this is not a recent phenomenon, but people are more willing to talk about mental health concerns. People will openly say, I struggle with depression, I have bipolar disorder, I have an anxious disposition. And the more we talk about it openly, the more, of course, aware we are of it in the community, but also the better we can address it.
So I've sometimes seen this described as more of a urban kind of phenomenon, but you're seeing it happening locally in rural areas as well. I guess I wondered, is there any difference that you've been able to tell between the two?
I think the kinds of stressors that people experience might be different in different locations. I think people in the city might be more stressed by living in close proximity with others, interaction with others, crowding. But fundamentally, the things that are difficult in life are largely conflict with other people, challenges in our relationships, whether they're professional or personal. And those things I think are universal. I'm not sure I would, I don't know the data on differences between urban and rural areas, but I certainly don't see less mental health trouble in our community than I did, say, in Philadelphia where I worked before.
And social media is often pointed to as one source of a lot of particularly teen anxiety and, anxiety among a lot of people probably, but do you subscribe to that theory? Do you think that that's a big reason why we're seeing, increase or at least more conversation about mental health?
I think that there's really solid emerging evidence that social media and time spent on it for teenagers can be extremely challenging. The fact that social media tends to feed a little bit of an addiction type of cycle where you're constantly looking for thumbs up, likes, followers. That constant need for feedback makes it hard to put down, and it in itself it can be challenging for kids who already have self-esteem concerns. And even without that, it takes away from the other things we need to be doing as humans, whether we're adults or kids, spending time outdoors, being physically active, spending time in the physical presence of others. And so I think for all these reasons, it's a big challenge. And if I could turn back the clock, I might prefer not to have it. I think the horse is out of the barn, though.
We should have stopped with the fax machine, I guess, huh?
Yeah. There are definitely advantages to technology, but I'm not sure that social media is one of them.
Well, I've also noticed, just to wind things up before we have to let you go, your practice here, the clinic, has expanded to, you now have several folks working in the mental health area. There used to be just one, I think, not so long ago.
Yeah, we initially started our mental health program with one therapist, and over the years we've grown. We now have 4 therapists who are employed by us, as well as one who's here 1 day a week through the Blueprint for Health, and a psychiatric and mental health nurse practitioner who does the psychiatric prescribing for our more complex mental health patients. And it's been a tremendous asset to us. About 1 in 3 of our visits in primary care addresses a mental health or substance use concern. So this really helps us broaden the resources that are available to our patients.
Okay, well, we'll leave it there for today, Dr. Van, and thank you very much for your time. And, well, we'll be back to see you again soon.
Thank you.
Okay, we're back with Dr. Heidie Vasquez Garcia, who is a licensed psychologist with over 25 years of experience and who's just started here at the Battenkill Valley Health Center, where we're talking to her. Dr. Vasquez Garcia, thank you very much for making the time to be with us.
Thank you so much.
So we're talking today about mental health issues and kind of focusing a little bit on teen mental health, teen adolescents mental health. And I guess I just wondered, just to get us started, what is going on physiologically with teens as they age on up towards 20-somethings? How is brain development occurring during that point in life?
So there are a number of areas that are transitioning and developing for teens. Physiologically, they're entering into this period of hormonal changes. Their bodies are changing. They are becoming more sexually active. Cognitively, they are changing as children transition into adolescence and then into young adults. They are becoming much more able to access abstract thinking, being able to think about thinking, metacognition. So there are lots of ways in which adolescents are really strengthening kind of their ability to think about the world. Socially, they are also in a big state of flux, moving from peers that are like them in some ways to taking more social risks and expanding their social circle. And experimenting with different types of relationships, and also moving away from family relationships a little bit more and expanding into a greater network. And emotionally too, they're developing in terms of their ability to access emotions, process emotions, and regulate their emotions. And this is also connected to brain development too during this time period.
So this transition, the state of flux that teens are going through, I suppose that also can be directly tied into anxiety and mental stress and some of the concerns and anxiety that we've been hearing a lot about, particularly in the last few years. But I suppose this has been going on for probably since the beginning of time, I guess. But what do you think are the main factors that influence teen anxiety? Is it you talked about relationships there, and just sort of the evolution of the brain itself? Do things like family situations and economic circumstances, educational circumstances, do those play a role as well?
Absolutely, absolutely. And there has been research that shows some differences between in terms of mental health outcomes that vary according to different socioeconomic factors, different cultural factors, for example, exposure to trauma. So there are lots of different factors that contribute to mental health outcomes for teens. Interestingly, there have been some really important studies that have come out recently after, or not after, but just as we're emerging from COVID, around how COVID impacted teenagers and brain development. There's a study that showed that teens' brains aged about 3 years. And it's a small study, but the impact of COVID, I mean, you talk about different factors like family and social factors. Certainly, we do not live in isolation. We live in communities, in systems, in contexts, and those contexts impact us. And for teenagers who are in this incredible period of development and growth, we are going to see that those contexts really have an impact on them in lots of different ways.
Let me back up for a second and have you talk a little bit more about that COVID time. Because schools were shut down for almost an entire year, or many schools were closed, and students were taking classes online. So at a time when kids are in a very social phase of their lives, they found their social interaction probably much more restricted than usual.
That's right.
I imagine that there must be reams of studies out already showing that had an incredible effect.
I am not aware of the whole body of research, but certainly isolation played a big role. And the context in which students were learning. I mean, if we think about the impact of COVID on families, so it wasn't just that teens were isolated from their peers and they did not have that kind of social contact and that kind of learning from others, but also there was a lot of stress happening for families. And so that shifted the dynamic of kind of the social context within a family, and adding stress, adding additional kind of stressors, perhaps, that a lot of times, made it very difficult for teenagers to bounce back from.
And just to follow up a bit on that, how do you feel like a lot of the current events that are going on right now? We seem to be going through a very troubling time. A lot of world events that are happening that 2 or 3 years ago we wouldn't have expected. The war in Ukraine, the war in the Middle East, climate change is another issue. I'm sure that many teenagers think a lot about, since it's the world that they will be inheriting as they grow older. Do you think those things play a role too, or is it just too early to tell?
I don't doubt that they do play a role in some way. They impact all of us, and there is a lot of anxiety and uncertainty, and adolescence is a time of growth, of opportunity, and a lot of stress and uncertainty. And I don't think that. Well, I absolutely think that what's going on around us impacts us, and it absolutely impacts teenagers. How it impacts them, I think, is a matter of what they bring to the situation. If they're able to talk about these worries and anxieties with their parents or their peers or their teachers, if they're able to process the emotions that come up, if they have a supportive group of friends that they can share how they're feeling about these things. So I think that there are lots of protective factors that can help teens kind of survive these moments of uncertainty and distress and worries about what's happening in the world and how they're going to make it in the world.
Right. So how can parents be best supportive of that for a teen who's going through mental concerns or anxiety issues, or even just sort of being a teenager.
Yeah.
What's the best way for a parent to kind of, be supportive?
I'm so glad you asked that question because I think parents play a huge role, and I want to encourage kind of the engagement pre-teen, before the teenage years, because a lot of this is around establishing routines and structure, and present and being around. And I know that families are super busy, and parents are really busy between working and getting things done and helping out their children in so many ways. There are lots of stresses for parents, but being present for teens when they want to talking with kids about their own experiences as teens themselves growing up, being vulnerable as much as they can about emotions. And I know that that's hard for parents because they're trying sometimes to, keep it together for their kids. But I think modeling for them, hey, this is something important to talk about. I can see that it's bothering you or it's worrying you. Creating a safe space for them to talk about those kinds of feelings, helping them to understand how important the basics are, like eating well, having a good kind of sleep schedule. Sleep is so important to teen development, to brain development, to the consolidation of information and learning, academic development. I mean, sleep impacts, or lack of sleep has been shown to have pretty significant detrimental effects. And so I think that parents can really help teens focus on the basics: eating, sleeping, modeling communication, and providing support, emotional support, social support, helping them to connect to friends and environments that will be supportive to them.
And another issue that comes up frequently in conversations around the subject is sort of early use of substances like alcohol or drugs of one kind or another. I wondered if you could talk about what is the exact physiological impact if a teen decides that one way to cope with anxiety is to have a beer or a glass of wine or something else. I've heard frequently that the use of substances like that before you're 18 at least, and probably before you're in your 20s, can be very harmful. Is that the case?
That is the case. That is the case. This period of adolescence, as I mentioned before, is such a time of development. What's going on inside the brain is there are lots and lots of new cells being formed and new connections being formed. And there is a process of generation, and then there's a process of pruning. So the cells that, or the pathways that aren't needed are pruned back, almost like you would prune back a plant. And the pathways of learning that are important are being fed or supported. And what alcohol and other substances do is that they impact the generation of cells and the forming of those important connections. And there have been some studies that show that teens who start drinking or using cannabis, marijuana earlier on, so early on in their adolescence, have worse outcomes than teens who postpone the onset of alcohol or cannabis use until later teenage years or early adulthood years. So it is such a critical period for the brain in terms of development that substance use can really alter how brain structures are formed.
Sure, absolutely. Well, all right, we'll leave it there for today. And thank you again, Dr. Vasquez Garcia, for being with us. And well, to all of you, we'll be back here again in a couple of days to talk to two of the other folks here at the Battenkill Valley Health Center who work in the mental health field. So I hope to see you then. Thank you very much.